Gado gado with kanda, two kandas. Did you see them? The eggs in there.
Yes,
Exactly. Listen, we're with Dr. Darren Green today, talking about back pain and the issues all around that. We've invited you to call us on 083-913-3728. Snosbongi Le on the line from Johannesburg. Good morning.
Good morning, Minjani.
Siyaphila wanonjani?
Ngiyaphila, ngathola umntwana nge-epidural ngo-2005. So since then, iqolo lami libuhlungu, angikwazi nokuma, angikwazi nokuhlala.
Okay, so an epidural in 2005, and since then she's got problems standing and even sitting. So what would you say to that?
So the epidural is not supposed to give you prolonged or chronic back pain. An epidural is there for pain relief during surgical procedures, like for cesarean sections, for example. Epidural is there, obviously, to give you pain relief that is injected into the space of the fluid that surrounds the spinal cord. And then you have, because of that pain medication, entering and numbing the nerves around that aspect of the spine, then pain-free, no sensation below the level in which it was injected.
Yes.
What does, however, lead to pain in quite a few cases is one of the things is called a cerebrospinal fluid leak. In other words, where the place where the needle actually enters that space, if the patient's clotting mechanism doesn't patch that hole quite significantly, you have a slow leak of cerebrospinal fluid out of that place. And normally the main symptom there is postural headache. In this case, however, we're talking about 2005.
Yeah, it's a long
What
time
can
ago.
relate to pain now? Certainly scar tissue at that level can, whether there was bruising at the level of the epidural, whether there was scar tissue that's now formed,
yes,
that's also perhaps pressing on some of the nerve tissue in that area, or whether she has secondary mechanical pain of that area. You know, the tenderness over the area where women get an epidural often is quite sore for months afterwards, but this is a little bit too long. I would advise that Sibongile definitely seeks help to have it at least imaged, to look at the specific area. If she's point tender on a specific area, one would want to go and look and see, are there any specific pressure effects on the nerve tissue or on the spinal cord at that level? And, you know, examine her properly to look for other symptoms that she might not even know she has at this stage.
Absolutely. Yeah. So, thank you very much for the call, and we hope that that answer did help from Dr. Darren Green. I want to talk about something else that also relates to ladies wearing high heels. Can that ever contribute to back pain?
Yes, it certainly can. You must imagine with the elevated stilettos, you are then obviously pushed forward. It changes the curvature of your spine, your back arches more because of the pelvic tilt of the pelvis. And then you have then obviously compensatory mechanisms higher up in the spine, like your neck, for example, in dealing with those high heels. You'll notice ladies don't walk normally with high heels. They glide or shift forward. It's not like a military march where they lift their knees up high, and you know, you often find them with those high platforms. The mechanism by which they walk is quite interesting. The poor models on international runways, if they wear those shoes quite often, you can imagine. But it's about the duration of exposure in that posturing, and also then your back hygiene. What are you doing to strengthen your core to maintain posture muscles? You know, but there are quite a few things that play a role here.
All right. Well, we're going to take some more calls after the break on 083-913-3728. We're talking about back hygiene and back health with Dr. Darren Green, and but after the break, we'll also talk about back problems that are specific to men and women. So stay tuned for that and more on your Feel Good Breakfast Show. We'll be right back.